Welcome back, everyone. This is going to be our second overview session. This one's going to concentrate on Chapter 13 and Chapter 14. Now, in 11 and 12, we focused on the nervous system, and we started learning about the main components and their overall functions. Now, what 13 and 14 are going to do is they're going to go ahead and emphasize the peripheral nervous system and the reflex activity for 13. And then when we get to chapter 14, we're going to take a look at the autonomic nervous system, which of course is also part of the peripheral nervous system. Now, please keep in mind this is an overview, so it will be a very brief analysis of the chapter. Please make sure that you take a look at the more detailed outlines for chapter 13 and chapter 14. Read through them, and then whenever you're comfortable, go ahead and pick the best day and time within the availability to do your last exam, which will be open notes and open book. Please reference the schedule as well as the syllabus for more details, or feel free to send me an email if you have any questions, comments, or concerns. Now, take a look at this breakdown. This is in essence what the chapter is going to allow you or is going to expose you to and hoping that you'll learn about. It reminds you that the peripheral nervous system is the connecting point with the sensory receptors sending input towards it. And then, of course, it sends the motor output to the effector. What the peripheral nervous system does is it takes these signals from the sensory receptors and it sends it over to the central nervous system, the brain and the spinal cord. That will then decide what needs to get done. And once the decision has been made, that gets sent back over to the peripheral nervous system where it will communicate with the motor outputs for the effectors so that we can get things like a muscle contraction, a gland secretion, and hormone production, anything that your body requires based on the stimulus that was received. The chapter is broken down into different aspects. What I would like to do is I would love to show you some of the main nerves that are involved within the peripheral nervous system. So please take your time, peruse through. And like I said, mine is just going to be a really quick overview, including showing you the main nerves and discussing a little bit more about reflex activity. This particular diagram, it just kind of reminds you that within the peripheral nervous system, you have the division of the sensory afferent and the efferent, which is the motor division. So that's what's going to give you your results, whether it is going to be a somatic nervous system, so that would be involving like your skeletal muscles, or if you do your autonomic nervous system, which is going to be more of a visceral type of reaction. In that case, it's either going to be a sympathetic, where everything gets increased and it gets hyped up, heart beats faster, breathing in and out at a faster rate, or it can be parasympathetic, which is the calming down, returning back to homeostasis. Here's a beautiful illustration of what a typical nerve looks like. As you can see at the smallest, we have our axon that can be myelinated. And as it's myelinated, we'll also get an endoneurium layer membrane that will wrap around this. These axons will be bundled together in fascicles, and fascicles are covered by a perineurium. And then the fascicles collectively, as well as with the blood vessels, will then seal together to form a typical nerve, and that has the outer layer, which is the epineurium. And if some of you are going, that looks very familiar, that is because when we talked about muscles, we talked about the same thing, that the muscle fibers will go ahead and form their bundles, which will ultimately lead to the formation of the muscle, aka the organ, which of course also has its membrane layers that wrap around, separating. When you take a look at a nerve, you can have a nerve that is fully efferent, you can have one that's fully efferent, or you can also have a mixed nerve, which means that you will have sensory and motor output that are mixed in together within the same bundle. Here is a look at a cross-section of the nerve taken from a microscopic view. So once again, you could see the introduction of the blood vessels. You could see the cross-sections of the axons. And then you could see the bundling of the different fascicles that come into play that are being separated by the perineurium. And then, of course, the endoneurium being the innermost. And here, surrounding the whole entire entity, is the epineurium. It's pretty cool to look at. Now, Chapter 13 is going to go ahead and start introducing you to the different nerves based on the section that they originate from, and it will also talk to you about the ultimate function of that particular nerve. Part of the reason why I take 11, 12, 13, and 14 and turn it into an open book exam is because there's so much different information that these particular chapters introduce. And I find this information very fascinating, but I also find it to be somewhat overwhelming, especially if we're trying to get everything done in a short period of time. So part of what I would recommend for you for your exam prep is, of course, reading the chapter outline. And as you're looking at the illustrations, try to take a look at a lot of the figures as well as the tables. So for instance, in this figure, figure 13.6, we can focus on the cranial nerves, which are the nerves that will radiate out of the cranium, aka the brain. And as you can see at the bottom, you have this beautiful chart where it has been numbered for you from cranial nerve 1 through 12. And it talks about the fact what the name of the nerve is, such as the olfactory nerves, the optic nerve, the trochlear nerve, the facial nerves, and it will also go ahead and take a look at the overall sensory function, if it has any motor functions, as well as any parasympathetic fibers that will come into play. Now, this is not where all the nerves end, right? Because we're going to keep radiating downwards. The next section of the chapter is going to go ahead and remind you that as the spinal cord emerges and travels down the vertebra, it will also start sectioning off and create what we call plexus. And what a plexus is basically a aggregation or a bundle of nerves that will radiate. So here you can see we will have the cervical nerves, which are going to be radiating out from the neck. We have our thoracic nerves. That is going to be more of the upper torso. The lumbar nerves is going to be found more towards the bottom part of the abdomen section. And then finishing it off with the sacral and the coccygeal nerves. Once again, please take your time, read through the outline, and take a look at how these nerves work together to not only provide input and output for their individual areas, but also allow for communication to happen within the body itself. There will also be specific sections where they'll concentrate on the locations with more detail. So you'll have the plexus of the cervical section, and here you could see how the what I call it, the alignment or the distribution of the nerves come into play. And a lot of times within the nerve name, it will highlight the overall section as well as the function that it will pertain to. Here is a look at the brachial plexus. That one's going to concentrate more on the fact that it's going to radiate from the axial nerves by the armpit and then travel down the arm and the hand to allow for the nerves, the formation of the upper limbs. Somewhere along the way, there is a cadaver. Here you go. Look at this beautiful cadaver photo where you could see the muscles with the striations, but you can also see now the nerves being separated and highlighted and how they innervate within the muscles, allowing for the sensory and the motor output to occur. And this branching off will occur throughout the rest of the so as the chapter continues, it will start hiding the lumbar plexus, the nerves that will come out of here. Probably most of us know about the sciatic and the femoral nerves. These are some of the larger ones that intervene and of course allow for sensation down the lower limbs. Here is a look at the lumbar plexus from an anterior view. And then we should also have the posterior view. Here's the sciatic nerve. Most of us come into play with this because we'll get like that pain in our hip. A fun fact is men, especially because they tend to carry their wallet in their back pocket, if the wallet is, let's say, too filled, or if it's not positioned correctly, depending on the location of the pocket, it can actually cause a pinched sciatic nerve to occur. Interesting fact. When it comes to the nerves, there is some guidance that physicians will often utilize to kind of keep an eye on how these nerves are laid within. This is what we call a dermatome map, and what that is basically areas of the skin on your body that rely on specific nerve connections on your spine. And it's almost like a map. So the nature of these connections is then utilized when a patient comes in and they talk about a particular pain that they're experiencing. And then on the flip end, if surgery is required, surgeons can rely on this map to keep an eye on the particular nerves that might be affected by the type of surgery that are going to be completed. So it's a nice little map of all the nerves radiating and how they innervate with the particular sections of the body. As you may recall from our previous discussion on our first overview, I talked to you about the fact that you have reflexes, and a reflex basically means that once stimulated, you will consistently get the same result over and over again. And always the prime example is you put your hand on something hot, you pull it away, and this is in essence to save you from having like a second or third degree burn. Please keep in mind that when you do these reflex arches, it will always involve the same 5 steps. And I know you've seen this illustration before, so you could see in blue how it's highlighting the fact that that is the sensory, the afferent that's coming in, and it's responding to the receptor, who's the first one to detect the stimulus. In this example in the picture, you can see that there's a nail embedded in the piece of the skin. The receptor detects it, it communicates it with the sensory neuron in blue. And then in green, you have the most common neurons that we have in our body. Those are interneurons. So they're our integrating center where we can receive the stimuli and decide what needs to get done. And that message is then sent out through a motor neuron to the effector. And in this case, it would mean that you would have a muscle contraction that would occur so that the skin can be pinched or removed from the site of injury. I would like to also go ahead and examples of some other reflexes. And this one is called the knee-jerk reflex or the patellar reflex. This is an example of a stretch reflex. And some of us might have had this reflex, or I should have said experience with this reflex. When you go over to the doctor, most of the time, if you do a physical, they will go ahead and test your reflexes. And part of what they'll do is they'll have you hop on a table, somewhere where your legs are kind of dangling, and they'll take their little hammer and they'll tap right below the patella ligament. And when this is engaged, it should go ahead and encounter, or it should activate the quadriceps to start stretching. And this will then go ahead and cause a swinging motion to occur. And if we see that the reflex is there, that usually means that the nerves are responding accurately. If we see that there is a delay in response, that usually might take a little bit more investigating to see that the nerves are healthy and responsive. Probably the one that you don't think of, but you've used definitely, is what we call the cross-extensor reflex. And this happens in the case when you are utilizing your gait or your locomotion. And as you're walking and you step on something sharp, what we see happening is that your body has to do 2 things. One is it has to remove you from the site of injury. So it has to go ahead and cause a flexor reflex, which means the site of injury. So let's say like in the picture, we see we're standing on something sharp. That particular foot that's exposed to the injury, once the stimulus is received, what we see happening is that the motor neurons are engaged so that the flexor can be excited, meaning that we're going to pull up the foot. And as you pull up the foot, you move it away from the site of injury. However, as that foot flexes, the other leg has to now carry all of the body weight because we don't want us to tumble over. So what we see happening is simultaneously as the flexing is occurring on the site of injury, the other leg will now extend, and this reciprocal activation will allow for the muscles to now gain the body weight for both sides, allowing you to still stand up straight and not fall over because of the reflex that has been instigated due to the injury of you stepping on it. So please take a second and explore this image. My apologies. It's very interesting because it allows you to see how one side of the body is in essence inhibiting your extensors while exciting the extensors on the other side. And it is exciting the flexors on one side, but then inhibiting the muscles that flex on the other side. So this is an example of a cross-extensor reflex because it's causing opposite reactions to occur on either side of the body. And chapter 13, you're going to see, even in my discussion, very short, very brief. But like I said, it has a lot of information because it's going to focus more on the individual names of the nerves and where it innervates and where it overall functions. So obviously, please make sure that you have your outline with you and peruse through it before you attempt to go and do the homework as well as the exam. This will then lead us over to chapter 15, which is going to focus heavily on the autonomic nervous system. So we're staying within the peripheral nervous system, but what we're going to do in chapter 14, we're going to go ahead and take a look at how the autonomic nervous system, how it's different from the somatic nervous system. And we're also going to highlight the fact that it is divided between the sympathetic and parasympathetic division. So we're going to take a look at how the nerves can often dual innervate the same part of the body. One nerve will cause excitement, sympathetic, and the other ones will cause the calming, which is the parasympathetic. I have right here that I want to show you. And both of these will represent the peripheral nervous system. And what it's showing you is the difference between the motor neurons that you would have in the somatic nervous system versus that of the autonomic nervous system. Now, the somatic nervous system, this should look very, very familiar because this is all about engaging with the skeletal muscles. So whenever the peripheral nervous system sends off the effector to the somatic nervous system, it is all about engaging skeletal muscle. And remember, that means that we're looking at things like our neuromuscular junction. So in the diagram, we could see that we have our neuron. It is myelinated so that the signal can travel faster. And when it gets to the synaptic knob, it's going to be releasing acetylcholine. And of course, we're thinking back to our chapter 10. Our acetylcholine, my apologies, chapter 9, our acetylcholine will then go ahead and engage with the receptors that are on the synaptic, my apologies, will engage with the receptors that are on the sarcolemma within the synaptic cleft of the skeletal muscle. And remember, with this case, we're creating action potentials, which is an all or nothing response and will always be to stimulate the particular area, meaning to engage the muscles and get them to contract. If you're now switching over to the autonomic nervous system, we see that we have two options. We can excite, which is the sympathetic. And when we take a look at the sympathetic, what we start seeing is instead of a single neuron, we're going to have two neuron chains that will go from the central nervous system to our overall effector organ. And you might notice that as it does so, what we're going to be doing is we're going to go ahead and we're going to start releasing a neurotransmitter, just like we did with the somatic nervous system. The difference here, though, is what that neurotransmitter is. Instead of using acetylcholine, the sympathetic nervous system will utilize norepinephrine, or it can go ahead and engage with glands such as the adrenal glands right here, which will cause the acetylcholine to be released from our primary neuron, and the secondary neuron will then respond by releasing epinephrine and norepinephrine either within the bloodstream or closer to the effector organ that we're looking at. Either way, if it's the sympathetic nervous system, what we should be seeing is that there's going to be an increase in activity. So more glands will start producing or secreting items. Your respiratory rate will start increasing. Your cardiac rate will start increasing. You're getting hyped up. On the other hand, you have your parasympathetic nervous system. The parasympathetic nervous system will go ahead and once again engage with two neuron chains from the central nervous system. You can see that the myelinated axon will travel over and release acetylcholine. This will then travel over to the postganglionic neuron, and over here it will release acetylcholine again. This acetylcholine and the reaction of the parasympathetic nervous system will have a calming reaction, an inhibitory reaction on the areas that it's affecting. So this is the part that will bring your heart rate back down, bring your respiratory rate back down, stop the production of certain enzymes or hormones. And oftentimes the sympathetic and the parasympathetic system will work in balance. So you go up for a little bit and then you reset. It's all about returning yourself back to homeostatic parameters depending on the situation that you are placed in. Here is a look at some of the anatomical differences. I'm going to put a little star in here because this will really highlight the differences between the sympathetic and the parasympathetic. This, as well as a table that's found at the end of chapter 14, will be very helpful in obtaining or tracking some of the differences as well as similarities between these responses. So as you can see, let's start with parasympathetic. Remember, that's all about calming and getting everything down. It says that the fibers will originate in the brain stem or the sacral spinal cord. The preganglionic fibers are long, so that's coming off from the first neuron. The postganglionic fibers are short, that's from the second neuron. And the ganglia, the cluster of cell bodies, are within or near the visceral effector organ. So they are close to where they need to have their ultimate results. Now let's compare that to sympathetic. This one says that the fibers will originate in the thoracic and lumbar spinal cord. The preganglion fibers are short, not long, which means that the postganglionic fibers now are long, not short. And the ganglia tends to be close to the spinal cord and a little further away from the effector organ. So this figure 14.3, is super helpful because it allows us, just from an anatomical standpoint, to see how the sympathetic and the parasympathetic are set up differently. Here is at the location of the sympathetic trunk. As you can see, they can be found on either side of the spinal cord. So here's the highlight of the spinal cord. And then you can see them on the side right here. You have the sympathetic trunk as well as the ganglion. As the chapter proceeds, it's also to you about what it calls pathways of how the innervation, the connection between the fibers and the nerves will work together. And one thing that it will highlight are different pathways, depending on if you have a synapses or a connection point that's at what they call the same level, meaning from the spinal cord over to the sympathetic trunk. If it can be found at a higher level, so you could see it originates here and then it's innervated at a higher level, or if it will pass through the sympathetic trunk over to a synapse in what we call a collateral ganglion, how that response will be. So these are just basically locational terms to see if the effector will either go towards like things like the skin, like the sweat glands, vasodilation or constrictions within the blood vessels, and of course the secretion of different glands, as well as peristaltic movement of the smooth muscle. Here we see another look at the sympathetic division of the anatomic nervous system. And what it's trying to highlight the fact is that as we're looking at the preganglionic and postganglionic innervation, that this is occurring a little bit lower down within the spinal cord. And as you can see, based on the sympathetic trunk, as it radiates outwards, it basically intervenes with every single part of the body that we would require in case there is any type of fight or flee type of scenario, as well as the secretion of the different glands, enzymes, and hormones. All right, so I know we talked about reflexes before, but this one just kind of highlights the fact that if you're doing a visceral reflex, we see that it might have a specific section within the integrating center and motor neurons that come into play. So once again, it will always start off with a stimuli, and that receptor will be in more of a visceral outing that will then communicate within the neurons over to the integrating center. Now here in this case, we want to remind ourselves that as we can see from our picture right here, we have a preganglionic neuron that will come into play. The dorsal horn interneuron will also often be in the integration center. And then as the motor neuron gets approved, you want to keep in mind that you will have, because it's two of them, you will have the preganglionic and the postganglionic neuron that requires the communication. And of course, as we saw a few slides back, depending on if it's going to be sympathetic or parasympathetic, we would have to take a look at the neurotransmitter. Is it acetylcholine? Is it epinephrine? Is it norepinephrine that's being released to allow for the communication to proceed? Obviously, the end report will be that you'll have an effector respond and thereby completing the 5 steps that are needed for our reflexes. Here is a look of the different automatic nervous system controls that we see within our section of the ANS. And when you get to this particular part of this chapter, I want you to take a look at the hypothalamus. I mentioned to you the hypothalamus before for in our previous chapter, and I said to you it's involved in many different things. Things from temperature control to water levels, reproduction, hormone control. In this particular section, we'll talk about how the hypothalamus is often referred to as the boss, part of it because it has this massive amount of communication and integration that it allows for the anatomic nervous system. It will also highlight things like the reflexes that we see that the spinal cord contribute for things like erection, ejaculation, urination, movement of fecal matter. The brainstem will also come into play whenever we would need things like dilation or constriction of the pupil, pumping action of the heart, respiratory rate and airflow, sympathetic or parasympathetic interaction of the saliva. When we get excited, we see that usually the saliva, the quality of the saliva will tend to be affected. When you get nervous, your saliva tends to be thicker. And of course, when you get hungry or you think about food, your saliva tends to be more watery because of the fact that it has more digestive enzymes. So your body has this very intricate way of reacting. And in essence, we could spend a whole semester talking about the autonomic nervous system, the somatic motor neurons, the difference between the peripheral nervous system and the central nervous system. So I want you to keep that in mind because I know that I have gone super quick over chapter 13 and chapter 14, and that is because I just really want to give you just a nice basic overview, and I want your time and explore through the outline and take a look at the illustrations of the book, and just read through the chapters. Take your time. Table 14.1, I think, is a fantastic table because it takes all the information that we have within 14 and it allows you to compare from an anatomical as well as a physiological view the differences between the parasympathetic and the sympathetic division. So it summarizes everything. Um, Having said that, I'm going to stop here because I really want you to spend some time on the chapter. If you have any questions about it, please let me know. Like I said, this is a super quick overview. Pull up the more detailed chapter outline, read through it. And if you would love to have a discussion, if you're not really sure about it, we will definitely be able to do so during our next time meeting. And of course, I'm always an email away. All right, everyone, I'm signing off. Have a great day. Bye.